Sec. Okay, good evening, everyone. And again, thank you very much for joining us on our Kawakib webinars today. We have a very interesting presentation, and let me begin by introducing Professor Donald Mathuna, or Mathuna. Please correct me if I didn't pronounce it correctly. Thank you. I had the pleasure of meeting Donald a while back as we both serve on the Center for Disaster and Humanitarian Ethics, him being the director and my being just a senior fellow. And we've had the chance to talk about a number of things outside the official work, mostly about Donald's work in refugee camps in Gaza, I think, and somewhere else, and his very interesting literary / educational cultural experience. To go presenting him on a more professional level, let me say that he is Associate Professor at the Ohio State University's College of Nursing and the Center for Bioethics and Medical Humanities. He's also Visiting Professor of Ethics in the European Masters in Disaster Medicine, Università del Piemonte Orientale, Italy. I hope that's correct too. And Director of the Cochrane Affiliates at OSU's Helen Fund Health Trust, National Institute for Evidence-Based Practice in Nursing and Healthcare. His research focuses on ethical issues in disasters and humanitarian crises, particularly research ethics in such contexts. He has contributed to ethics initiatives with the World Health Organization, UNICEF, and UNESCO, and authored numerous peer-reviewed articles and books. It's really a pleasure having you with us, Donald, and thank you for giving us the time. The floor is yours.
Okay, well, thank you, Talia, and thank you for everybody visiting our seminar from Beirut and much further beyond. So I hadn't realized when we were kind of planning this webinar that today is a big day for us who have our origins in Ireland. And in some ways, I wish I would have called it something like what St. Patrick has to teach us about COVID-19 vaccine ethics and humanitarianism. What I am going to talk about are the COVID-19 vaccines and the implications of the ways that those are being distributed. But I want to tie it into a broader issue of not only the ethical question about what really is the ethical thing to do, but how do we motivate people to become more engaged with this issue? And part of the reason why, some of you may or may not be fully aware of St. Patrick, but he is the patron saint of Ireland. He actually isn't an Irishman himself, or not originally. He came to Ireland as a slave, an exile, was put to work in these mountains, the Mourne Mountains. But he escaped and then came back with the message of Christianity to Ireland. And we're very fortunate that we actually have some of his writings from the 400s. And I'm going to refer to those from time to time because I think he has some really important principles to bring to this type of discussion. He tells us, so these are the two writings that we have from him. But he tells us that he was taken to captivity, into captivity to Ireland with thousands of others. In those days, the Irish were the ones raiding other countries like neighboring England and Scotland. But he was dragged over to Ireland, and he says, "This is where I now am in all my significance among strangers." He says later on, much later in his life, where he says he lives among uncivilized people, a stranger and exile for the love of God. And I think it is this memory of St. Patrick as a stranger and an exile, which is very important in Irish people's kind of cultural memory and their engagement with concerns about humanitarian settings. But I want to come back to that later on, but first talk more generally about the COVID-19 vaccines And there is certainly a lot of ethical debate happening right now around who is going to get these vaccines when, at the moment, there isn't enough for everybody. This is a global pandemic. The infections are global. But the relief that comes with the vaccines is being built up. But the question comes up then, who and when are people going to get these? This is part of the bigger question that has dominated throughout the pandemic for the last year, in terms of the ethics questions about what to do when scarcity abounds. We read of the various tragedies in different parts of the world when Italy was running out of space and ventilators. Similarly, kind of spreading to New York. But around the world in poorer countries, there similarly have been the issues that have not gotten the same degree of attention. Likewise, in refugee camps that you in Lebanon are much more familiar with than I am. And this brings then, with the hope that the vaccines bring, the question of who and where are people going to be getting the relief. There's an ethical imperative throughout all of this in many ways. And there is plenty of guidance on what the right thing actually is. As this reported to how scarce resources should be distributed in a pandemic several years before COVID-19. When resource scarcities occur, the tenets of biomedical ethics and international law dictate that triage protocols are necessary to guide us in how to allocate these. International law requires a triage plan that will equitably provide every person the opportunity to survive. However, such a law does not guarantee either treatment or survival. But the issue here for ethics is that the ability to survive or to receive treatment should not be left up to just the whimsy of others. That there needs to be an equitable, a fair, and a just method of distributing the resources. And so in the US, for example, the National Academies of Science, Engineering, and Medicine published a framework for the equitable allocation of the vaccines when they would become available. And in these, we see what would be regarded as the kind of traditional ethical principles that have been incorporated into various state plans around the US. But I think what we see in this is that these principles do not just simply apply to a local context, but need to be and ought to be applied more broadly. Sorry, could people mute their mics, please? There's noise from somewhere. And I'm just going to mention very briefly some of these ethical principles, because they really just highlight that, that there are very strong ethics arguments that would support the importance of getting vaccines to humanitarian settings, not only into well-resourced settings. The maximizing of benefit is about promoting individuals, and this has to have a balance in it between individuals and the public. It takes into account various types of benefit. But there is also an element of this that covers the preventing and the reducing of harm. And part of the issue here is that if one country or one region focuses on getting its own people protected, then as we see today, the variants are kind of growing in other parts of the world, and things are just going to come back and reinfect regions where protection is introduced unless there's a global approach taken to this issue. Throughout this national framework, there is a concern for the equal treatment of all people. And again, this does not just apply to citizens of one country or people of one region, but that there is a question of the equal dignity and worth of all people. And that this needs to infiltrate into the plans and how the vaccines are being distributed. Sorry, just again, could you mute, please, your...
No, tengo mucho.
So the third general ethical principle that the framework includes is the importance of mitigating health inequities. And these are the systematic differences that exist in the health status of different populations. In the US, this has led to a lot of concern about making sure the vaccine will get to various groups of people or all groups of people, including African-American populations, Native populations, those living in crowded situations. And this one principle alone would require that the concerns of those living in crowded refugee camps or in settings where there already is very limited access to healthcare resources should be brought to bear and should really be prioritized in many ways. And then there are procedural principles included in this framework about fairness, transparency, and being evidence-based. And clearly the principles of fairness apply very directly here to humanitarian settings also. So this national report did also include a call for the US to designate a certain percentage of the vaccines that would become available in the US to be given for humanitarian settings. However, it doesn't seem like that has really been taken seriously by many of the providers of the vaccine. For another reason, throughout these prioritization systems, there is an emphasis on the importance of prioritizing healthcare workers. And this is based on a number of different principles that those who are taking care of the patients who are becoming sick need to be protected in order to be able to continue to deliver the care that is needed. And again, this highlights the importance of prioritizing the healthcare workers who are actually engaged in humanitarian settings, who are working in the refugee camps, that they also should be prioritized along with healthcare workers working in well-resourced locations. So when we move into global allocation systems, we see that the World Health Organization's guidelines similarly put an emphasis on protecting those who would be protecting others. So in the scheme that the WHO has developed, they would want to have a rollout of the provision of vaccine to all countries based originally with getting 3% to every country, which is their estimate of the percent of those populations which would be involved in healthcare and social care work to cover all of those workers, and then increasing after that stage to 20% as quickly as possible so that those at the highest risk could be treated. After that point then, as more doses become available, different countries would get different amounts of vaccine based on the needs, the extent of the pandemic in those countries, the vulnerabilities. So in many ways, a very similar ethics plan to what was proposed within the US system, but this on a global level. You also may be aware of the COVAX system, which is the mechanism that has been put together by WHO, and Gavi, and a number of other international agencies to try to ensure that the vaccine would be available for all countries around the world. However, what we're seeing now is that in spite of the plans that were in place, that practically these efforts have really been undermined by what has come to be called now vaccine nationalism, the way that many countries in the world are pursuing vaccines on their own and not as part of a global plan like COVAX. And this, according to the director of the World Health Organization, is actually undermining the whole COVAX initiative. So this initiative, as I mentioned, was put together by many different countries in the world, and all countries were invited to get involved with it. 182 countries have committed to it, and the general plan was that the high-income countries would contribute the funds to this, but low-income countries could join. And then as the vaccine would become available, the joint fund would purchase the vaccines, and then they would be distributed to all countries on an equal basis to try to be based upon the principles of equal concern, of justice, of fairness. And most countries of the world joined this, but not three of the major powers initially. The US, as of last month, has made a commitment to this. President Biden committed $2 billion upfront and another $2 billion to follow based on cooperation with other countries. But while it is great that the funds are now finally starting to come into this, it has been noted that what is actually problematic here is an underlying commitment and or lack of commitment to global justice. And as one economist has pointed out, that what really is not being fully understood is that what will help Americans the most is not vaccinating every American first, but having a just distribution of the vaccine so that relief can be brought to all parts of the world. And so why is this? Well, what is happening at the moment, this map of the world identifies the percent of the population that were in each country based on the numbers of vaccines that have been put into contract. So what the dark green that's over Canada, for example, highlights is that Canada has contracted to purchase 4 times more vaccine than its population. So while not only is the vaccine going to countries that can afford to do that, it means that other countries that would like to be able to get some are not going to be able to get it in the near future because all of the available vaccine, as it becomes available, is going to be going to those countries that can afford to have these contracts in place. As what's the name of this document highlights is that there are already about 10 billion doses have been contracted, mostly by the wealthier countries. And so for those countries that are waiting on COVAX vaccine, it is going to have to wait until not just the immediately available vaccines, but until all of the wealthier countries have had stockpiles available to them. And this is why the COVAX mechanism has been alleged to be undermined. Because when is the vaccine going to become available? There are concerns that some countries will not get it until 2023. And this is a huge problem for the world, not just for those immediate areas. So what other documentation is showing is that while the world's availability and administration of vaccines is increasing dramatically, we see that at the top are some of the wealthier countries. So the United States leads the way, followed by China, then the European Union. When you look at where the people are who have obtained much of the vaccine, you see that, again, most of the countries getting most of the vaccine are the wealthier ones. Now, I highlight Bangladesh on this because you may not have noticed, but on this chart, which shows each of the countries, Bangladesh is barely a blip on the bottom of that chart. And yet it is very high up among poorer nations. But when you then zoom in on where Bangladesh counts among other countries, you can see that it is way up beyond countries even like Lebanon, Pakistan, many of the poorer countries, or even countries like Egypt and Uganda. Bangladesh apparently has worked very actively to secure vaccines that are being produced in its neighboring India. But for the most part, again, the poorer countries and those that are in humanitarian crises to begin with are just not getting access to these. So what I've been laying out so far is that there are many ethical reasons to support a different approach to distributing the vaccines globally. But there are arguments that go beyond ethics. Trillions of dollars are being spent in economic protection and recovery around the world, whereas it's estimated that it would take only 40 to 50 billion to completely cover the costs for COVAX. Economically, it doesn't make sense to why it is being done this way. There's an argument for self-protection, that the virus is not going to respect borders. If it continues to replicate and to mutate in other parts of the world, it is going to come back, as we see currently with the concern for the new variants in Europe. Recovery has got to include everybody because global trade, global travel is just not going to be able to recover until the whole world is in better shape for the pandemic. But then the moral argument, I think here, this is where I'd like to spend the remaining part of this, and that we need to go beyond simply the rational arguments that ethics and economics can provide. And again, I think this is where St. Patrick can really help us. Because St. Patrick was a very strong advocate of the role of character in ethics and the place that narratives can play in motivating people to actually do the right thing, to become the types of people who do what is ethical, not just to talk about what is ethical. I'm going to cover a few of the ways that I think narratives and humanities can really bring this up. One is the power of memory. Patrick never forgot the roots that he had come from. He never forgot that he began his teenage years as an exile, a refugee, and a slave. He says, "I am then first and foremost unlearned, an unlettered exile who cannot plan for the future. But this much I know for sure, before I had to suffer, I was like a stone lying in the deep mud. Then he who is mighty came, and in his mercy, he not only pulled me out, but lifted me up and placed me at the very top of the wall. I must therefore speak publicly in order to thank the Lord for such wonderful gifts." He brought his ability to survive, or his opportunity to survive, not down to anything that he had done or he had deserved, but to the way that God had rescued him from the setting. And he never forgot that this was not about him or his opportunities, but that it was about then his approach to gratitude for what he had already received. We see then, as he mentioned there, that this led him to be committed to speaking out. He, in many places, saw that what is really important is to remember others who are suffering likewise. In his book, The Confession, he regularly remembers those who are similarly suffering. He talks about young girls saying their fathers disapprove of them, so they often suffer persecution and unfair abuse from their parents. And to these must be added the widows and those who forego their marriage rights. Of them all, the women who live in slavery suffer the most. they have to endure terror and threats all the time. And so speaking out is something that can be done through our words, through remembering those, and is something that the humanities and literature often do. The power of a painting to speak many more words than words will. I'm very grateful for Talia bringing me into contact with Imad, who has powerful art that can represent the terrible conditions that people have to live in the world, that maybe is just so different from our own experiences. But I love as well the way Imad has included the dove in this painting, the kind of universal reminder of hope, of peace, of the ability that someone will come and speak up for those who are in poverty or who are under the injustices of the forces that exist throughout the world. And this is something that I think the humanities can bring out very powerfully. History is something really important to remember. And so the Irish remember the famine of the 1840s. This has become again part of our national memory, of how the country went from a population of 6 million to about 4 million in just a few short years, about 1 million dying and about 3 million emigrating. And so Ireland, as the United States knows very well at the moment with St. Patrick's Day, is a country of immigrants. And this should remind us of our roots and the fact that we often are strangers in other lands. But also there's a new book that's been published just last year, The Voyage of Mercy, which I think is another important example from history. This recounts the voyage of the USS Jamestown, which was the first international humanitarian mission that brought food from the US to Ireland at a time when Ireland's rulers, our British neighbors next door, were ignoring the problem and not doing anything practically to address it. There's one beautiful story that is recounted in this, where Native American tribes in the west of the US collected their harvest and sent it as part of the shipments of food going to Ireland. As a result, our president in the 1980s, in the centenary of the memory of aspects of the famine, was made the first female honorary chief of that same tribe. The power of memory in history, we know, can be destructive. And yet it can also be something for great good and help to unite peoples that maybe have little or nothing in common, other than the fact that they have been through suffering, they've been through deprivation, and can use that to motivate one another, to help one another. Poetry is another way that I think we can bring out our moral imaginations. This poem was written in the 1880s. Keep, ancient lands, your storied pomp, cries she, with silent lips, give me your tired, your poor, your huddled masses, yearning to breathe free, the wretched refuse of your teeming shore. Send these, the homeless, tempest-tossed to me. I lift my lamp beside the golden door. A beautiful poem recalling the importance of one group of people welcoming another group of people. This poem is located, it's etched in concrete on the bottom of the Statue of Liberty, and is a reminder of the roots of where the United States has come from, that it is a land of immigrants, and similarly can become a call to remember that, to have the imagination then to help others around the world that are similarly in the types of straits that others were in the past, that our ancestors were in the past. What the humanities do, I think, is that they have a way of just grasping a deeper part of us that goes beyond rational arguments and economic analyses. As another of our Irish playwrights says, George Bernard Shaw, you use a glass mirror to see your face. You use the works of art to see your soul. And we need to touch our souls in order to address what's happening with the vaccines locally and globally. And part then of what St. Patrick brings to all of this is a reminder of our shared humanity. Patrick wrote this other letter after the Irish villages that he was working in as a missionary were attacked by Scottish raiders, much in the same way that he was brought to Ireland in the first place. But now, as a leader in Ireland, he spoke out and wrote to these soldiers, demanding that they bring back the slaves that they had captured. But he admits his own emotional engagement with this issue and his lack of certainty as to what exactly to do. He says, "I do not know what I am to say or to speak, for it is written, be sad with those in sorrow." And elsewhere, "If any member grieves, let all the members grieve as well. Therefore, I will cry aloud in sorrow and grief. They think it a disgrace that we are Irish. But Scripture says, have you not all one God? Why has each one of you deserted his neighbor?" And so by going back to our shared humanity, realizing that we are all created in the image of the one God, that we can realize we are neighbors more than we are enemies. We should be neighbors more than strangers. That in the eyes of those who are appealing for help, who are being forced out of their land into other settings, that we can touch their soul through the humanities, be moved ourselves to share in the responsibility to do something about the issues that are facing people around the world. So in conclusion then, I'd just like to say that global justice requires much more than ethical arguments. I don't undermine the philosophical and the rational arguments, but we need more because we need to be moved to personally engage in action. And the humanities play a very important role in motivating us to actually become just, not just talk about justice. Thank you very much, and I'd be happy to open it up for discussion, questions or comments.
So, Donald, let me begin by thanking you a lot for this amazing presentation and talk, actually. Not only do I see a human being who has the common worry we often have, at least some of us, about sharing our fate, but a scientist, a cultured human being, well-read, using what I think you would agree with, something Pellegrino once said, the most scientific of the humanities and the most humane of the sciences. So as Alexis Carrel once said, when the tongue is full, the heart refuses to speak. So I really don't know what to say at this point. I really enjoyed your talk a lot. I have a lot of questions, but I'm not going to take the role of my friends here. I just want to highlight one quick question among the many I have in my mind. If you recall, during our last meeting, we talked about humanitarian action or humanitarian endeavors being colonized versus decolonized. Since you mentioned rights, different countries, the duties of different countries towards refugees. And yet we see a lot of concern from well-off countries in as far as helping those who are less well-off, particularly refugees. We see concerns about different vaccines, and you've probably heard the statement or the argument that most of the time they think the West will take the best vaccines, but will send the global South the worst vaccine or a different version of the vaccine, which is not as efficient. So I'm being very honest with you. This is what's being said. So I'd really like to hear your point, your view on that, and then I'll leave the floor to my colleagues. And thanks again, Donald. I really love this. And I'm happy you managed to get in touch with Ahmad. That's amazing. Okay.
Well, yeah, well, I thank you for those comments. And I think that the concern that you're expressing is part of the detrimental effect of what happens when things are not done justly and when trust doesn't exist. And so there's a bigger consequence, I think, to things being done selfishly or to a lack of concern for people around the world, in that not only in the immediate issue of, let's say, people's needs go unmet, but there is then the long-term mistrust that comes about when you weren't helped before. And so then that mistrust, I think, comes into play in ways that you said. So if they didn't trust us before, or help us before, or they helped in a way that actually was in their own interests, how can we trust them now? And I think it's a legitimate reaction to the injustice that exists in the world. What I think the only way to overcome it is that if people, if the vaccines truly are made available, where there is a proportion of all of them made available as best it can. I think with some of the early vaccines, there obviously are challenges with the super cold storage that's required for those. So there could be practical reasons why one vaccine is not suitable in other parts of the world. But I think there are ways that the vaccines that are being made available globally should be those that are as effective as possible. And I think that's where the ethics should be infusing all of the decisions, where people who are providing the vaccines are not just trying to give second-class ones off to kind of alleviate their consciences, but truly are trying to help in equal ways, in just ways, those that need them elsewhere. So I think that is part of it. And I think the other thing that is really crucial, and I think it's really important that there are developments happening in the ways of a community engagement, of making sure that people from the local contexts, people who understand the cultures where needs are being addressed, are involved throughout the decisions that are being made, so that there are ways to present the information that are culturally appropriate, that there are people involved who are from different cultures, who understand the science and the medicine and the public health issues, so that in contrast to the kind of older approach of the approach of sort of parachute humanitarianism, just dropping in and saying, here's what we have to offer, take it or leave it, that the help that's provided comes as a result of longer term engagement between those who are on the ground and who really understand what the local needs are. And I think another way too, just to finish up that part, is the involvement of the humanities as well, to see how kind of the cultural items, the poetry, the artwork of all people can be brought to bear in helping everybody to understand what is actually happening and how to address the needs the best. So that's my attempt to try to address that at least briefly, but it is a major issue and a major problem.
Thank you very much, Donald. I have in the chat just notes of thanks, but I'm going to ask if anyone wants to raise a question or make a comment. So just wonderful talk. Happy St. Patrick's Day. Thank you for your presentation. It's beautiful. What can I say? So thanks a lot, really, Donald.
Well, thank you very much for inviting me.
Dr. Jihad she raised her hand, so I'm assuming she has...
Okay, thank you, Tala. So, Turi, the floor is yours, Dr. Mahmoud.
Yes, good evening, Donald. Thank you for being here with us today. remember me, Judy Mahoul, from the European Public Health Association conference. We had a session together some years back. Great to have you with us. And thank you, Talia and team for arranging and organizing these wonderful seminars. And so just a few comments, I'm not really gonna take a lot of time, but just very quickly, as you were speaking, Donald, I was thinking about, our history. And so the importance, the points that you raised about the importance to think about, from St. Patrick's work or writings, shared history. So if we're just taking these and looking into the context of which, of course, obviously, our concern these days about our country. So if you look to and positive point of view, our shared history has, we don't have a shared history. We don't have a history, one history. Different schools teach different versions of history here in Lebanon. And these versions are, they up to the private schools, are left up to the private schools to determine what history is taught in the schools. And I think that is a very, very big problem that further deepens the divide among the Lebanese population and reduces the possibility of us ever having a shared history to begin with, let alone have a shared vision for the future. And the was that if you look into our history, you will see a lot of oppression, polarization, and conquest, ever since the dawn of time, even before the Ottoman Empire. So that is something that we can't do, use our history to unite. And so I'm afraid that that might be an issue for us, and it probably will require a lot of hard work and thinking, but also revisiting the way we teach history in schools and the whole education system. And I think for me, that's my opinion, I don't know if others would agree, I think the only history that many of us affiliate themselves with or connect to is that of the Thawra art, the revolution, the recent revolution, October 19, 2019. So a lot of art has come out of that. And every time I see some pieces, including the painting you referred to, I feel that there's a lot that this art says about ours, and many of us sort of connect because of the Thawra, and that is represented through the one way is representing it through the art. So I think the Thawra art one could argue that that is a uniting force rather than the history before the Thawra. And the issue of speaking out, last but not least, I think a lot of people are speaking out, and because of the oppressive regime that we have in this country, because we're speaking out, a lot of people are thrown into jail just by speaking out. So if you can see, then the context is totally different from what you are suggesting. I just wanted to just think out loud and share my thoughts with you on that one. Thank you very much for this wonderful talk.
Yeah. Well, thank you, Jihad. And you raised very important points. I was very concerned, kind of trying to address these issues at all, knowing that what you're experiencing is so different to what I have experienced and have ever experienced. And it is very, very challenging. And I think, it's, we in Ireland have had similar issues, although more in the more distant past. But I think it's where the idea of finding our common humanity is so crucial to help us try to go beyond whatever the most recent conflicts were. And that is very challenging. That's where, I think that the humanities are very powerful, that, somebody can see in the eyes of a child what applies to them, whether they're at different ends of the gun barrel. It's there is still a shared humanity there. Or something I didn't mention that I find very powerful is the kind of the photography of nature that we can see in the grandeur of a sunset or an eagle flying or something like that, that we can all acknowledge something bigger than whatever our conflict is. But I think it is really, really hard. And I was still living in Ireland when Queen Elizabeth visited about 10 years or so ago. And there was a lot of apprehension about that. We had, it had been almost 100 years since, a member of or a sitting royalty from England came to Ireland. But I was really surprised at how powerful it was that she was able to demonstrate her humanity in a very powerful way that really touched, I'd say, millions of people through her grace and her humility, and in a small way, her attempt to speak a few words in Irish, which I think there are ways that people who know their humanity can speak out in powerful ways and hopefully help to heal some of the wounds. But I know that is very, very difficult when those wounds are still open and bleeding, and it's a huge challenge.
Thank you both, actually. Thank you, Judy, and thank you, Donald, for this. Any other comments or questions? Okay, so thanks again. It was lovely having you with us, Donald, and I guess we'll see each other soon. So all the best to everyone, and have a great day or rest of the day.
Okay, thank you very much for organizing this, Talia.
God bless you. Bye-bye.
Thank you.
Take care. Thank you. Thank you, everyone. Bye-bye.
Bye.